We just want to talk today about object handling that you may encounter in your role as a volunteer. Just to stress, this is not around the safer moving and handling of patients or clients. This is purely for moving and handling that you may encounter as a volunteer. Many of you will have different capabilities, different experiences, so hopefully this video will help complement your existing skill sets and will keep you safe within your roles. What do we need to consider before an object moving and handling task or activity? Well, the obvious question is, can we avoid it? That's certainly the safest moving and handling activity. Where we can't, we need to carry out an assessment. And the best way of assessing a moving and handling task is to use the ergonomic approach, which is TILEO. T stands for the task, particularly can we avoid bending, twisting and overreaching. I is the individual, that's you. You're the best judge of what your capabilities are, what your previous experience is. Some of you may have had a lot of experience moving and handling, for others less so. The L stands for the load. So yes, certainly the weight of the object is very relevant, but also the size of the object, the weight distribution within the object, whether there's handles on it which are easy to grasp. And the environment stands for where you are handling from and moving to, making sure you've got a clear pathway, what the surface is like, what the object is like that you're putting the object onto, so shelving for example. And then other factors, E is for other equipment that may be used, trolleys, etc., and any other factors on top of that. And I think the question to ask yourself is, are you the best person to be moving the object in the first place? We're about to carry out a moving and handling activity. Questions to ask yourself is, are there existing manual handling risk assessments that you need to be aware of and to follow? Your own dynamic risk assessment using the TILEO model, task, individual, load, environment, other, equipment. And we're also going to demonstrate and talk about good position in front of the load. So when you approach a load, you certainly want to get close to it. That reduces the leverage force, which will reduce the effort that you experience during handling of the load. A good foot position will also keep you in a relaxed, stable and balanced position in relation to the load and the lifting activity. We're just going to break down what we did in the lift there. We come back to the assessment. Are we going to avoid the activity or are we going to take part in the activity? In this case, we decided that we were going to look at lifting the box. So I assessed the environment first of all, particularly to make sure there's no sort of triple slip hazards, any uneven ground, and also crucially where I'm going to put the load down, there's no obstructions there. I then approach the load and get into a balanced and stable position, potentially 1 foot to one side of the load and 1 foot to the other, can bring you in nice and close to reduce the leverage force on your back. I then making my assessment of whether I'm personally going to lift it. You'll notice I gave the load a little bit of a prod, a little bit of a tweak, just to make sure that that load wasn't heavier than I was expecting. And it's really a personal judgment call as to your own capability. But I would like to emphasize these types of lifts should be at the lighter end of lifting. Once I've decided I'm going to lift, I get a firmer grip, I get into position, and then I'm going to emphasize lifting with my legs. Quadriceps, hamstrings, gluteus muscles, big strong muscles in the body, certainly where most of your power is going to come from. Also, big emphasis on keeping the load close to reduce leverage force. The lift should also be nice and smooth. As I start to lift, just looking forward will help keep your back in a balanced and neutral position. And once I've lifted the object, turning with my legs, approaching the table, placing the object down on the edge of the table and then sliding it into position. Everything to be nice and smooth, nice and balanced, working within your capability. I always think in assessing, the moment you start to think carefully about the task you're about to do, you're immediately much safer. We're now going to apply the principles of moving and handling to a slightly different object. It's a smaller cardboard box which is closed. With an object like this, although it looks small, it might be surprisingly heavy, so it's always good to check the load before you handle it. And on this occasion, I'm going to open the load, the object, to look inside to see if there's anything heavy inside, as well as give it a little bit of an assessment beforehand. As there's no handles as well, I'm going to try and pick the object up using a slightly alternative type of grip, but one which also enables me to apply the principles of moving and handling, which is having flexion in my hips and knees, using my strong leg muscles, and also keeping my back in a balanced and stable position. We're going to talk about another common activity, which is pushing and pulling, and to some extent we might do this more than actual lifting. For pushing and pulling, we apply many of the principles of lifting, i.e. assessing, working within capabilities. With the actual technique itself, about having a balanced position, a good stable base of support, applying your hands to the load, typically somewhere between chest and waist height, getting a good grip or handle onto the object, and moving smoothly, using body weight and leg strength to apply the force to the load. Keep the action smooth, keep your body balanced and neutral, and avoid underload, bending and twisting. Keep balanced, keep neutral, keep smooth with the action. So just to summarise, we've looked at some principles for moving and handling. There isn't a one-size-fits-all, but certainly we as individuals will know our capabilities better than anybody. So please do work within your safe capabilities. Don't do anything that puts yourself or others at risk. If you're unsure, please do stop and seek advice from your volunteer coordinator or the health and safety or moving and handling departments for the organisations that you are kindly volunteering to support. Thank you.